Hi, I'm Sara, this is Henk, and we're going to show you a very quick screening examination today of the upper limb if there is a suspected traumatic nerve injury.
First, I'll go through the examination in real time with a model, and then Sara will go through it and explain what we're looking for. Good morning. I'd like to examine your hands, if that's all right. Can you feel me touch you? Mm-hmm. Does it feel the same? Mm-hmm. All feels the same? Mm-hmm. All feels the same? Mm-hmm. All feels the same? Mm-hmm. Excellent. Good. Spread your fingers apart. Keep them spread apart. Don't let me squeeze them together. Pinch my finger. Pinch my finger. Touch your thumb and little finger together. Stand your fingers up so they're pointing to the ceiling. Don't let me push them down. Squeeze my fingers. Push up to the ceiling. Push out. Push down. Push in. Stick your arms up like this. Push down. Look into my eyes. Thank you.
Okay, so we're going on to the second part now, and I'm going to show you how to do the examination, slow it down and explain what we're looking for. So we're going to start off by saying hello. Can we examine you? Mm-hmm. Okay, and then I'm just going to start by making contact with the patient, and we're going to start by examining both dermatomes and the terminal branches of the peripheral nerves. So we're going to start up here on the inner aspect, and that's T1. Going to make our way down to the little finger, which is the ulnar nerve and C8. Making our way across to the middle finger, C7. The index finger is the median nerve. And then across to the thumb, and that's C6. Then going to make my way down, feeling over the anatomical snuff box here, which is the radial nerve, onto the lateral part of the forearm. So this is the lateral cutaneous nerve of the forearm, which is the terminal branch of the musculocutaneous nerve. Going up now onto the regimental patch area, so the axillary nerve, but also C5 dermatome, and then up into the neck, which is C4 dermatome. Okay, so we're now going to go on to motor power and movement. So we're going to start off. Can I get you to spread your fingers out? And I'm going to test the power by squeezing those in. And these are the intrinsic muscles, and that is T1 and the ulnar nerve. Okay. I can also see when she's doing this that she's extending the fingers and the thumb. So these are the long extensors, and that is radial nerve C7. Okay, going on now, I want you to squeeze my finger. Okay, and this one. Again, testing the intrinsics. Now what I want you to do is to put your fingers like this, good, and thumb in the air. So what we're seeing here is the median nerve, the abductor pollicis, and can you pinch the finger and the thumb together? We now can see this O sign, which is FPL and FDP of the index finger. And this is specifically testing the anterior interosseous nerve, which is a branch of the median nerve. Okay, so if you go back to that position, the other thing this shows us is the intrinsics and any latent claw, so any weakness from the intrinsics, or in particular on this side, the ulnar nerve. Now what I'm going to do is get you to grip my fingers, and I'm going to get you to try and pull me in. And I'm going to try and straighten out at the same time. So what I'm testing here, and just show you from the side, is the power of the long flexors, in particular the FDPs. And we can test all of those, and what you can see is if there's any weakness, that's the median nerve on this side and the ulnar nerve on this side. And together this is C8 myotome. Okay, so now what I would like you to do is just to turn your hand so your thumb's up. So we've supinated now, and what I'm going to ask you to do is to pull me towards you. And what we're looking for here is the brachioradialis muscle supplied by the radial nerve, the biceps and brachialis supplied by the musculocutaneous nerve. All of this is elbow flexion, which is C6. Now what I'm going to ask you to do is to push me down. And this is the triceps muscle, which is the radial nerve. So now what I want you to do is to try and push against me, so crossing the arms. So this is internal rotation. This is the subscapular nerves. Okay, and then out. This is external rotation, so infraspinatus, and this is the suprascapular nerve. So now what I want you to do is to bring your elbows up. So what we can see here is when she initiates this, it's the supraspinatus muscle, which you can feel at the back here, and that's the suprascapular nerve. And then when she's in this position and holding it, and especially if I just ask you to push backwards, we're feeling the deltoid muscle supplied by the axillary nerve, and this is the C5 dermatome. Okay, now what I want you to do is try and put your arms back towards your chest. So what you can see here is pec major working, and then at the back you've got lat dorsi. So finally, I'm just looking at Rachel's face for a Horner's sign, so looking at the eyes for a partial ptosis and a small pupil. And this is due to sympathetic interruption, which is usually associated with a T1 nerve root avulsion. The other thing that we'll look for is in the neck area, any signs of swelling, any bruising, any previous scars. And we'll have obviously picked up any of the scars or injuries as we've done our examination. So at the end of this, if you have picked up anything abnormal, make sure that you refer it on to the specialist nerve teams.